Good afternoon, everyone. Welcome to the 12:30 session at the General Appalachian Studies. Topics including history, education, literature, and health. I just want to start by letting you know that my name is Michelle Maroney, by the way, and I'm the producer of this session. And I wanted to let you know that Elizabeth Glass is not going to be presenting in this session. Her title was Disability Nearly Absent, Today's Appalachian Literature, a look at disability's presence in Crystal Wilkinson's Birds of Opulence. So she is canceled for today. So we're just going to have two presentations today, and both presentations are pre-recorded. And I do not believe that the presenters are in the audience yet. So I will be starting the video of the pre-recording. I just need to mute everyone so we don't get any feedback. So I guess if you have comments or questions, use the chat, and that since the chat feature stays open, I believe we'll give access to the presenters access to the chat so that they can respond to your comments. There still seems to be a lot of people logging in, so I just want to wait another minute in case people were expecting to see the presentation from Elizabeth Glass. That presentation has been canceled, so I'm just going to hold on for a minute. If people are straggling in, I don't want to start and have people wondering what's going on. Okay, I think I've given it enough time. Just want to let everyone know that we have two presentations only. The Elizabeth Glass presentation has been canceled. So we're going to start with Rita Calestra and Samantha Stocksdale and their pre-recorded presentation called Engaging Beyond the Project.
My name is Dr. Rita Calestra.
And I'm Samantha Stocksdale.
And our presentation is titled Engaging Beyond the Project.
I'm stopping to do a sound check. Can somebody just open their mic or put in the chat that you can hear the sound?
I can hear it.
Great, thank you so much.
Using authentic touch points to enhance relationships and build community. First, we'll provide an overview of the literature and theoretical perspectives guiding our work. Our research uses a case study approach to examine engagement efforts in a community branding project in a rural West Virginia town. We not only focus on engagement, but on the specific area of community engagement, which involves cooperation and supportive participation in a process of working toward a common goal to address an issue of common concern. Community engagement is key to incorporating representative community voices into the decision-making process. And research has shown that having strong community engagement during the planning process can help produce revitalization that is more sensitive and considerate of the community's needs. Our approach also considers how engagement strives to build social capital and to improve communities. Our work examines engagement from the public relations perspective. In this area, communication is a process of co-creation of meaning between organizations and publics and focuses on the relationships between them. We use two main theoretical lenses as guides: relationship management theory, which involves building and maintaining organizational and public relationships around shared goals, and communication infrastructure theory, which considers storytelling networks of communities when they come together for planning. We also use elements of dialogic communication. Our work considers the importance of social media in building public engagement and positive relational outcomes, and we examine the use of storytelling as a strategy to increase engagement. We also consider the importance of events in engagement and in the organization public relationship. Our work also uses Taylor and Kent's 5 components of engagement as a guide. Very briefly, these components include conducting necessary background and secondary research to better understand a community and its culture prior to any type of interaction, demonstrating a positive regard for community input, experiences, and needs, and interactions involving different purposes, including those that are not specifically related to project or organizational efforts. With this information in mind, let's move on to the case under study, which focuses on engagement efforts in a branding campaign for a rural Appalachian community. Brand Journey is a grant-funded community branding initiative at West Virginia University. Taking a community-first approach, this project aims to revitalize West Virginia communities through research-based branding campaigns that are geared toward helping communities promote tourism, increase economic development, and boosting community pride. Brand Journey launched a year-long branding project in rural Pineville, located in Wyoming County. A primary concern at the onset was a lack of engagement from the community in previous unrelated town improvement efforts. So it was necessary for Brand Journey to implement non-traditional and personal approaches in its attempts to increase community engagement, not only for community-based research to create the new brand, but to also encourage brand and resident acceptance. My co-author and I were both a major part of this campaign, so we had a bird's eye view into the engagement efforts, their roles, and the outcomes. That also gave us access to the data for analysis in this study. So using prior engagement experience and the literature as guides, this study considers the following 2 research questions to assess the Brand Pineville campaign. First, what were the roles and outcomes of community engagement strategies used in the campaign? And second, how can the lessons learned from this case inform community engaged research and other collaborative community focused projects? As mentioned, this research uses the case study method to examine multiple strategies of engagement in the Brand Pineville campaign. And we use a multi-method research approach consisting of field notes, field and strategic observations, informal interviews, surveys, community roundtables, multi-platform social media analytics, and more to gauge Brand Journey's challenges and successes in engaging the public. As you can see, we grouped engagement strategies used in the campaign into 4 main categories, and each area was important for building engagement and relationships at different levels. The areas also address all 5 of Taylor and Kent's components of engagement. Project-specific dialogue included pre-project meetings before interacting with the community or even announcing the campaign. It also included background research as well as regular meetings to discuss important aspects of the project. Project-specific interactions included connecting with the community for elements specifically involving the project. These ranged from events to community-engaged research. Non-project specific interactions consisted of various events and interactions with community members that were not project related. And finally, storytelling and social and digital engagement included community storytelling videos, digital and social media engagements, as well as media relations efforts. Now I'll turn it over to Sam for the results.
So the first engagement strategy I'm going to talk about is project-specific dialogue, which included pre-project meetings with the team's key contacts. These initial interactions served as an opportunity to develop a community branding committee. The committee was made up of local stakeholders and area residents, including business owners, teachers, and local officials. The committee not only served as an advisory board for the team, but also played a large part in rallying the community. The team had weekly meetings with the key contacts and several meetings with the full committee. Some methods used to measure this engagement strategy included observations, field notes, and informal interviews. The team regularly received positive feedback from the committee, and when reflecting on the experience, the key contact said, "Brand Journey has given us a restored sense of community pride. It left us with wonderful memories and positive outcomes for the future, and it has allowed us the opportunity to reach out to new people wanting to get involved. The experience left a lasting impression on myself, my community, and its residents." This engagement strategy really laid a foundation for mutual trust and respect and played a vital role in the success of the project. Without the buy-in of the community stakeholders, the successes of other engagement strategies wouldn't have been possible. The second engagement strategy was project-specific interactions. And for the sake of time, I'm only going to talk about 4 project-specific interactions today, 2 of which were focus groups, or what Brand Journey called community roundtables. These roundtables served as community-engaged research opportunities and allowed the team and residents to co-create goals and intended outcomes for the project. Brand Journey used this opportunity to learn more about the residents' experiences, concerns, and ideas for improving their town, as well as their creative preferences, which were used to guide the creation of the town's brand identity. These interactions prioritize community participation and collaboration to earn resident buy-in and trust. And this served as a turning point for the project and created a sense of partnership for all future efforts. Prior to the 2 roundtables, the team hosted a community kickoff event where they introduced the project to residents and the local media. And months later, they hosted a brand launch event. And this is where they revealed the overall brand identity and strategy for increasing community engagement in tourism. One method used for measuring project-specific interactions was tracking community attendance at this event. You can see that the kickoff only had 17 attendees, but as the team furthered its relationships with the town and hosted more events, more people attended. The roundtables both met or nearly met the attendance cap of 25 people, and the brand launch had 100 people show up. This was a larger turnout than even the team could have anticipated. And this jump marked a 488% increase in attendance over the course of the project-specific interactions. And now we're going to show 2 pictures, and these illustrate the changes in attendance over time. So the left was taken at the first event and includes some of the team members, and the right was taken at the last. Another method for measuring the effectiveness of project-specific interactions was a survey that asked respondents to indicate their level of satisfaction with the brand identity, and this included creative elements and messaging. The survey included 5-point Likert type scale questions, asking respondents to rate their level of satisfaction from hate it, which was a 1, to love it, which was a 5. The results indicated that the average reported response for each brand element category fell just below a perfect love it response. And these outcomes suggest that the residents were invested and engaged in the process, which began during the kickoff event and was more thoroughly discussed during the well-attended roundtables. We also used informal interviews, field notes, and social listening as methods for determining the effectiveness of project-specific interactions. Immediately following the brand launch, the team received feedback from key community stakeholders, all which was positive, and noted an increase in community engagement. For example, the team's key contact said, "I can't thank you enough. I've had people come to me wanting to volunteer for the town, and I think the best is still to come." The same feedback and overall sentiment was visible across social media channels. The team's post-brand launch video received 165 likes, 286 shares, 16 comments, and 13,500 views. And that's not bad for a town of 736 people. So now I'm going to transition into the third method of engagement, non-project specific interactions. Again, the role of this engagement type was to meet community members where they were and show up to the gatherings that were important to them. While this engagement method was more behind the scenes, it played a vital role in building trust and establishing acceptance and meaningful relationships with the community. Without this engagement type, the project-specific interactions would not have been as successful. The team showed up for the community, and in return, the community showed up for them. This method of engagement was measured by field observations or residents' reactions to the team's presence. as well as digital and social observations or community members' engagement via social content related to the team's attendance. The team went to town events such as their rivalry basketball game, Christmas parade, fall festival, and lumberjack festival. And you can see here that the team received positive social feedback regarding their attendance. To further engage and build a relationship with the community, the team captured photos, videos, and interviews at some of these non-project specific events to fuel positive storytelling about the town. So the last engagement method was storytelling and social and digital interactions. And one way storytelling was integrated into community engagement efforts was by filming and producing short videos that highlighted points of pride for the town. One, as shown on this slide, highlighted the town's basketball team during their rivalry game. The effectiveness of this engagement strategy was measured through field observation while at the event and social listening after. Social listening included monitoring the residents' engagement and comments on the video. This video was one of the team's highest performers, reaching 41,635 people. 12,126 people engaged with this video, with engagements being post clicks, reactions, comments, and shares. And in total, this video was viewed 24,000 times. This shows an overwhelmingly positive response to the team's storytelling and digital efforts. Other storytelling efforts included residents sharing their own stories about their community, which you'll see referred to on the next slide as audiograms, as well as video recaps of community engaged research, events, and interactions. These were especially effective in reinforcing the co-creation of meaning and building trust and transparency. So finally, another social and digital engagement strategy was face filters. These are interactive augmented reality features on Snapchat, Facebook, and Instagram. This tactic was used specifically to engage with the town's youth and was measured through social media analytics. If we look specifically at Snapchat, the Warrior Pride face filter, which was backed by paid ads, received almost 4,000 impressions with 204 swipe ups. And for those of you who don't know, a swipe up is when a person not only sees the ad, but actually engages with and uses the filter. The Renegade filter, representing the other in-county team at the rivalry game, received almost 7,000 paid impressions with 427 swipe ups. And now I'm going to turn it over to Dr. Kallistra.
Thank you. Now let's move on to research question 2, which is how can lessons learned from this case inform community engaged research and other community focused projects? First and foremost, remember that people will not just show up and participate. You have to work at it using different methods of engaging them. Just because you're wildly excited about or an expert in a research area doesn't mean that you can expect others to display your same level of enthusiasm. Even if they are interested or passionate, remember that you're competing for their time in other areas of their life. Try to build excitement for the community engaged research and use a mix of engagement and research methods. Some ways to do this is through multi-platform storytelling pieces, social media promotion and engagement, and earning media coverage. Keep logistics in mind for community research. For example, incorporate an effective RSVP process for focus groups, not only to keep the number capped to ensure an effective discussion, but to also ensure that you'll have enough people in attendance. You can always open up additional focus groups if you have too many. That's a good problem to have. Offer some meaningful incentives. Don't expect people to volunteer their time, whether it be for a survey or focus group. And establish clear ground rules. Be ready for tough conversations and plan ahead for how you will deal with negativity to keep the conversation solutions oriented. Also, don't forget to take time to stop and acknowledge what's taking place. Remind participants of the importance of the process, that their input is unique and valuable, and that they're helping to shape the future of their town in a positive way. And also tell the story of the process. This creates shared meaning. Let's now discuss some practical advice for community work. Some of the same things hold true as what I just covered for research efforts. Again, you have to work at it using different methods of engagement. Consistent communication is key, especially with the main contacts. And different engagement strategies serve different purposes and roles in a project's success. Sam just covered some of this, and I'll recap more in the discussion. Meet them where they're at. Show up, be authentic, be genuinely interested in their community. Spend time there, talk to people, learn about their culture and history and their aspirations. Offer incentives for event attendance. Some tasteful prizes and gift baskets can go a long way. Don't forget to tell your story along the way. This helps to share the work that's happening behind the scenes, especially with the research process, which can take a while. And tell their story along the way. This helps to build bridges and show you're invested and interested in what they have to share. Now I'll briefly cover the discussion and some overarching conclusions. Interpersonal dialogue is important to establish mutual trust, respect, and transparency with your primary contacts. These people can serve as a bridge between your organization and the community, and they have a vested interest in collaborative and positive community outcomes. I cannot stress the importance of this. Excuse me, I cannot stress the importance of this enough. Events are important for showing your intentions and for establishing transparency and relationships with the members, and it's important for project buy-in. Social media can play an important role if it's strategic and if it's properly executed by someone who's trained in this area. It can be especially important for longer distance projects when the contacts from the organization do not live and work in the community. It also allows for continued shared meaning, connections, and conversations between an organization and its publics. It provides connections and can serve as a point of pride, especially when you're featuring videos of residents sharing their stories and experiences. Storytelling is valuable through all stages. It helps to build transparency and authenticity in relationships. And it builds a bridge between what's happening both at the forefront and behind the scenes and shows that collaboration and community input are valued. Finally, this research advances theory by proposing a new component of engagement, which is that engagement requires some initial buy-in and social capital from the community side, as well as extensive commitment from the organization to co-create meaning with the community. More on that to come in future research projects. Thank you for your time.
If any of you joined us after the session got started, I just wanted to remind everybody that the Elizabeth Glass presentation was canceled. So we only have 2 presentations for this session today. That was the first presentation, and they're both pre-recorded, so there's not, I don't know if make sure I'm not muted. They're both pre-recorded, so, and I do not believe the presenters are here. If they are, speak up. Okay, so we're going to move on to the second presentation for this session, which is Lauren Hudson. I'm having a little bit of a technical problem. Just stand by. Can somebody tell me, can you see a black screen with 2 circles in it? Or are you just seeing a blue screen?
Right now, at least for me, I can just see you.
You can just see me, okay.
Counting. Yeah.
I don't know why this is happening.
Oh, now I can see the screen with the, oh, wait, it went away.
I took
Oh.
it down. Okay. All right, let me try this again. Can you see it now?
Yep.
All right, can you make sure you can hear it? Thank you so much for helping me out.
My name is Lauren
Can you hear it?
Hudson, and I'm a current
Yep, I can hear it.
in
Perfect.
neuroscience and biology at the University of Kentucky. For my research, I work with Dr. Nathan Vanderford in the Markey Cancer Center at UK to examine cancer literacy and knowledge in Appalachian middle and high school students. Cancer literacy is defined as an individual's ability to understand general cancer knowledge, navigate risk factors, and make appropriate cancer-related decisions based off the advice of a healthcare professional. While all of the United States battles cancer, Kentucky experiences some of the most staggering statistics. We face the highest overall cancer incidence and mortality rates in the country, with 26,000 new cases and 10,000 deaths each year. The Appalachian region contributes greatly to this disparity. Residents of Appalachia are 8% more likely to die from a preventable cancer than other Kentucky citizens. This disparity is worsened by risk factors that include a variety of behaviors that increase cancer incidence. Poor health behaviors such as smoking, low physical activity, chronic infection, and deficient diet all increase the cancer risk in Appalachia. Additionally, poverty and low education levels contribute to a lack of knowledge of cancer preventative and treatment measures. This leads to decreased healthcare access and low patient compliance, thus increasing cancer incidence and mortality in this region. Our research strives to tackle low cancer knowledge as a result of the low education levels in Appalachia, Kentucky. To accomplish this, our research team traveled to 6 middle and high schools across Kentucky, which are labeled here on this map. The black line on the map represents the border of the Appalachian region. All of the schools are located in the eastern or central portion of the state. At these schools, we first administered a pretest with 10 cancer-related items to give an understanding of what the students already know. We then delivered a short presentation. This presentation covered topics like the biology of cancer, causes of the disease, preventative measures, and potential treatments. Following the presentation, participants completed a post-test with identical items to the pretest. It was hypothesized that this presentation would cause an increase in the correct number of responses from pre-test to post-test. 3 months later, we sent a follow-up survey to all participants to measure long-term retention rates and examine if the intervention increased cancer literacy rates even months later. The results from our study show an overall improvement in both the median and mean number of correct responses following the intervention. These graphs compare the number of correct responses on the pre-test versus post-test. The median percentage of correct responses increased from 50% to 80%, while the mean increased from 50% to 77%. Additionally, there was a significant improvement on the number of correct responses for every single question on the test. Students also retained their new cancer knowledge in our 3-month follow-up survey. These data suggest that even a brief educational intervention can increase students' understanding of cancer. These results have been recently accepted for publication in the Southern Medical Journal. This table provides participant demographics and specific score increases for each school. As you can see, there is an increase in score for all schools, all grades, and both genders. All of these increases are statistically significant, and the effects of the educational intervention are evident across the board. This survey also asked about the participants' likelihood of changing their habits following the intervention on a scale from 1 to 10, with 1 being the most unlikely and 10 being the most likely. The average rating was a 6. It also asked how likely participants would be to encourage a friend or family member to change their habits. This question averaged an 8 out of 10, which is slightly higher than the previous question. This aligns with our hypotheses because middle and high school students are less likely to participate in behaviors like smoking, and consequently, they are more likely to use this information to encourage the adults in their lives to change their habits. Lastly, participants rated the degree to which the intervention affected their understanding of cancer, and this averaged a 7 out of 10. Similar studies have produced comparable results. A 2015 study of Mexican students saw a substantial increase in students' knowledge of cervical and breast cancer following an educational intervention. Another study examined the same increase in the health literacy of Japanese adults caused by a similar presentation. The results from this study show that cancer education has the potential to increase cancer literacy and encourage healthy lifestyle choices in Appalachia, Kentucky youth. In order to make a significant impact, we believe cancer education should be incorporated into middle and high school science and health curriculum. Previous research has shown that cancer education curriculum should be created with 3 characteristics in mind. First, the curriculum must be culturally tailored. In Appalachia, Kentucky, this means incorporating cancer statistics specific to the region and considering economic and cultural factors that influence residents' lifestyle choices. Additionally, curriculum should be ongoing, meaning that it must be more comprehensive than the 1-hour intervention we initially gave. By presenting students with cancer-related information over several lessons, we can provide students with additional information and increase the likelihood that they will retain this information. Lastly, curriculum must be geared towards an impressionable population. Specifically, middle and high school students are at a crucial point in their lives where they are making decisions that can influence future health behaviors and outcomes. By presenting students with cancer-related information at this point in their lives, we hope to increase the likelihood that students will make healthy lifestyle choices. In other research we are conducting, feedback from middle and high school science and health teachers in Appalachia, Kentucky revealed that there are barriers to incorporating cancer curriculum. One such barrier is classroom time. Teachers are already required to teach a number of topics outlined by state and national standards, and they note that there is simply not enough time to teach students information outside of those standards. To overcome this barrier, we worked with researchers at the University of Kentucky College of Education to create cancer curriculum that is aligned with high school science, health, and engineering standards. By doing so, we hope that teachers will be more receptive to incorporating cancer-related curriculum into their lessons. The cancer curriculum we created based on teacher feedback has 3 main lessons that are designed to be taught in 3 to 4 class periods. The first covers cancer basics, focusing on the biology of cancer, and describes cancer disparities in Appalachia, Kentucky. This first lesson gives a student the necessary information to understand and ask proper questions regarding a cancer diagnosis, and it also highlights Kentucky as a region with high cancer incidence and mortality rates. The second lesson discovers factors that make it more likely for a person to develop cancer, such as smoking and obesity. It also discusses how individuals and populations can mitigate these risks and live a healthier lifestyle. The third lesson teaches about various methods of cancer treatment, touching on both common and rare treatments. Each lesson contains interactive activities to engage students and promote critical thinking. The first 2 lessons range from about 30 to 45 minutes in length, with the third lesson taking about an hour. To accommodate all classrooms, Lesson 3 can be split into 2 parts to cover 2 class periods. There is also a short version of Lesson 3 for teachers who don't necessarily have the time for a full hour lesson. Each lesson is equipped with a PowerPoint presentation and a detailed lesson guide to assist teachers with the subject matter. At the conclusion of each lesson, there are post-test questions for students to test their understanding. There are also curriculum evaluation questions for teachers where they can provide feedback on the lessons and their implementation. In the near future, we hope to analyze the responses from both teachers and students to brainstorm how the curriculum could be improved for future classrooms. This research has the potential to increase cancer literacy and knowledge levels in Appalachia, Kentucky. Consequently, this could cause citizens to make healthier lifestyle choices and motivate participants to share this knowledge with those around them. Ultimately, if cancer-related material is taught via ongoing, culturally tailored curriculum, it has the potential to decrease cancer incidence and mortality, thus neutralizing the cancer disparity in Appalachia, Kentucky. Funding for this research comes from the National Cancer Institute and various offices at the University of Kentucky, as shown to the right. I want to thank Dr. Nathan Vanderford and the Appalachian Career Training and Oncology Program at the University of Kentucky for supporting me in this research. If you or someone you know would like additional information regarding the curriculum, please reach out to me and Dr. Nathan Vanderford. Our emails are listed here on this slide. Thank you for listening. Have a great day.
So Lauren is not here either. So if you'd like to get in touch with Lauren or Nathan, they had their contact information. That is all the presentations we had for this session. There are other sessions continuing until 1:45, and then there's a 15-minute break before the award ceremony. And one of the beautiful things about this virtual conference is you can go sneak into another session and everybody in the room is not going to turn around and look at you. So I would encourage you, if you wanted to go check out a performance or one of the other sessions, to pop in so that you can take a little break before the award ceremony. And this might also be a good time to check out the posters and the exhibitors that are on the website. So thank you all for coming to this session.